Welcome back. 8:51 now. Last week, a study from a researcher at the University of California, Berkeley found some pretty disturbing details about tampons. The study looked at 14 brands and found toxic metals, including arsenic, in some of those tampons. So the study didn't name the brands, but said that they were found in both organic and non-organic tampons. So joining me live this morning is Dr. Sarah Trahan. Thank you for being here with us. You're with the Sonoran University staff physician at the Neil Riordan Center for Regenerative Medicine.
Yes,
thank you for being here. So let's talk about this study. Should we be alarmed? I mean, I think, you know, all women know that there's some sort of risk with tampons. You know, we've talked about this before, but what does this study in particular reveal that is new?
Yeah, absolutely. So like you said, there are studies that have shown us this in the past to some degree. Now, this is an analytical study. It's not looking at humans and how much we absorb and how much that affects us. So it's a step forward to then understand what study needs to be done next to better understand our risk, especially when using these products for decades. So we do now know that there are alarming number of chemicals in the tampons that will be used, but we need to understand how much of that we're absorbing and then how that's affecting our health.
What other alarming chemicals were found? I know we mentioned arsenic right there off the top, but
cadmium, lead, to name just a couple.
Okay, and lead is, I mean, no level of lead is really good for the body, but there are certain standards that the EPA sets. What does that look like?
Yeah, so they found much lower concentrations than what the EPA sets, but the EPA is setting standards that might not be a benchmark of health, but maybe an industry, what they can accomplish. I think it will be also interesting to know what these, you know, this cocktail of chemicals will do for us in terms of our health. Moving forward. So only this amount of lead is concerning, but what about the lead and the mercury and the cadmium?
The combination of it all, right? The length of how long we've been using them, right?
Exactly.
So we as women, what do we do? Do we ditch these altogether? Are there safe brands, safer options?
Yeah, well, I think it inspires, researchers to ask more questions, to get more funding for understanding what we need to do to move forward to be safe. But they have menstrual discs, they have menstrual cups, they have external barrier protections you can use, such as pads or period underwear. All that can mitigate your risk by keeping those concerning cottons and rayon fabrics outside of the body.
And I know studies are just being done looking into the products themselves and not necessarily, like you mentioned, how much of the metals we're absorbing or the effect on women. But are there any cases or any studies that have linked the use of tampons to health concerns for women?
Not to my knowledge, no. I did a PubMed search recently to see if that was the case, but I did not find anything. What I do find in clinical practice is when people stop using the cotton or rayon tampons, their cramps might improve.
Oh, really?
So that's just an interesting, anecdotal finding that a lot of clinicians have found.
Okay, great. And with a lot of different other options on the market, we can start to make better choices. But it was concerning when you hear that even in organic brands. So what should we know when looking at that, not to be fooled by the word organic?
Yeah, even when you're grocery shopping, right? So it's not always best. They have different apps like Environmental Working Group, the Yucca app, YUKA, and that helps you to scan a barcode and it tells you maybe the risks that you might be putting yourself at with the parabens, endocrine disruptors that might be in those products. So moving forward, we're just more informed.
Okay. All right. So maybe we try a different product, right?
Yes, absolutely.
All right. Dr. Trahan, thank you so much for being here with us this morning.
Thank you.
And just to mention, too, we did reach out to the Center for Baby and Adult Hygiene Products for a statement, but we did not hear back from them. So from here on out, yeah, maybe we make a better choice. All right. We'll be right back after this.